Okay, we're going to go ahead and get started. I understand there's a bunch of people online, and people here in our auditorium, so I just want to make sure we keep on track. And I assume someone can see the Zoom and I'm standing in the right place. Yeah. Okay, terrific, great. So I'm Allison Brashear. I'm the Dean of the School of Medicine, the Jacobs School of Medicine, Biomedical Sciences here at the University of Buffalo, and Vice President for Health Sciences as well. I'm also a professor of neurology here at the Jacobs School. So first of all, I want to welcome you to the Jacobs School, both the folks here in the auditorium who I think are still getting coffee and snacks, and also to everyone who's online. We have a really important topic to talk about here today. It's the sandwich generation, balancing the care for parents and children. And I know that many of us have been in this situation, and I think it's actually just shows the fact that we all know what that term means, such that this is a emerging issue that all of us are dealing with. We are really trying to help support our staff and faculty and help everybody here, both in the auditorium and virtually, really balance their lives so that we can have people who are highly productive and happy and also are able to balance the stress of the management of our multiple different roles. So before I get going too far in some opening comments, I want to really thank Dr. Jill Cizek, Associate Vice President for Research Administration, and Brianna Odowalski. Did I get that right? All right. I really want to thank them both for their work on this. They envisioned this. They led to the planning of the event. I also would be remiss if I didn't really talk about and thank Dawn Swirly, who's in the back hiding. I see her behind there. Dawn really gave a lot of input, and whenever you see me standing up here with gorgeous slides, usually Dawn has been the one that puts them together, and so she really helps us tell the story. So the thing that makes this so meaningful today is really understanding our personal connections and how what is going on in our lives helps really shape our story and how we're committed to transforming the health of Western New York. And that really takes a understanding of the vision of healthcare, the coordination, and really also understanding how all of the things that we experience as individuals shapes our passion for making a difference. So we're all educators, we're researchers, we're innovators. Some of us are in the clinic. I was in the clinic yesterday, but all of us have family and friends, pets. We have people out in the community that we interact with. So this idea of the sandwich generation is really something that I've experienced personally, and I believe I actually learned about the sandwich generation back in the early 2000s. So in that time, my mother was ill and eventually passed away when our children were 2.5 and 5. At the same time, my mother-in-law also had cancer, same breast cancer. She survived, but she had Alzheimer's disease at that time and ended up having Alzheimer's disease for 18 years. So I understand and get it that it is really, really hard. It is really hard to have young children, older parents who are ill, older parents who are aging. Some of us have siblings that have challenges. As I have a single sister who's has no children and lives alone and has also been ill. So these are all things that we're also really dealing with. Balancing parents, balancing siblings, balancing children. And then, of course, we all have pets, right, who are near and dear and meaningful to us. And these are all the things that impact us. I think personally that understanding those things and thinking compassionately about how everyone has something in their life. And I think that helps make us all better physicians, better educators, better faculty, better staff, because we're all a family here. UB is one great big family, and UB really is a driving force of what goes on in our community. And one of the most important things about Buffalo is it is this passionate community where we care for people, where we go out. I mean, I've never been in a place where people are more welcoming and more willing to go that extra mile. It is actually incredible. And so that's one of the reasons why we wanted to put this on. We want to give people the tools to deal with these really complex issues that every single person faces. This is not something that just a select group of populations faces. Everyone faces this. So your presence here online, thank you so much. Here in the room really signals that this is important. And it is also our way to say that the well-being of speaker, that's why we have hopefully the tools to continue. So with that, it's now my honor to welcome our keynote speaker, Mary Brennan Taylor. Mary is a nationally recognized advocate for patient safety and a powerful force for change in healthcare. And I will say, without telling more stories, patient safety, I learned about patient safety when I was in middle school, when my father, who is alive and a physician, didn't have his labs checked post-op for a week. Later, when I was in medical school, he had me go get his labs, and we learned that the pre and the post-op labs were significantly abnormal, which medical school.